Hello, everybody. Welcome to One Mic Conversation. Schizo, I'm here with Mary Beth O'Connor. She wrote the book Junkie to Judge, a woman's triumph over trauma and addiction. And I'm very pleased that she's here because I think it's a very important conversation to have. I'm trying to find you. There you are. Because the reason why I wanted to talk to you about this is because for the past 12 years, I've known people on and off who have died from drug overdoses. Half of them, about half, have been found on the street, and one that I knew for about 25 years, from when I was about 12 years old, that they were found on the corner dead from a drug overdose. So I feel it's very important to show people that even if you do drugs or anything like that, it's not over. You can recover and go on to do different things, and that it's not the end of the world, and there is a way out. So I'm really thankful for you to be here today. So how are you doing?
I'm doing great. I'm excited for our conversation. Thanks for having me.
All right, and you're also what made you decide to write the book?
So,
Um,
when I was appointed a federal judge, which, by the way, was when I was 20 years sober, I do like to emphasize the dates. It was sort of a natural reflection time. Like, how did I go from shooting meth at 17? I didn't get sober until I was 32, and then become a federal judge. And as I was thinking about it, I started thinking, could my story be of use? Is there any value in putting forth the it's significant effort to tell my story? And so I started reading memoir, especially recovery memoir. And I noticed two things. One is that a lot of them sort of leap into the chaos of the addiction. They don't show where it came from. And I really wanted to show what had happened to me at that young age for it to make sense for me to use drugs early and excessively. But then also a lot of memoirs at the end, it's sort of like I went to a couple meetings and everything is great. And it's like, well, that's not how recovery works. And so 30% of my book is my first 3 years of recovery because I wanted to show a more realistic example of how people progress through the early critical part of their recovery process.
okay, so what if you want to talk about it, what caused you to start relying on drugs for whatever trauma you had? Was there a specific thing that happened to where that you felt drugs were more helpful than anything else at all?
I mean, that's the short answer. So I grew up in a household where my mother really wasn't connected to me and she was violent, but she married my stepfather when I was 9 and it got much worse. He was very violent with her. He was physically, sexually violent with me. It was just a very high stress environment. The example I like to use because I think it shows the level of stress in the house is that I taught my little sister that when we put the dishes away from the dishwasher, that was one of our chores. I taught my little sister to put the dishes away one dish at a time so it didn't clack because that might cause my stepfather to go on a tirade. And so it was
Okay.
just that kind of stress. And so, yeah, when I found my first drug, which was alcohol, which was when I was 12, and it was Boone's Farm Strawberry Hill wine, which a lot of people know. What I noticed was that it made me feel better. I felt, happier. I felt like, sort of like the tension was released from my body, and that caught my attention. Like this is a positive experience. I want more of this, and so I pursued alcohol, then weed, pills, hallucinogens, and then at 16, I found what became my drug of choice, which was methamphetamine, and I was shooting up by 17. So it was
Well,
definitely that childhood experience that caused me to make that choice.
now for you, because when I was growing up, you would hear that weed was the gateway drug. Do you think that it's not necessarily weed or anything? It's any trauma that you have is more of a gateway to other drugs rather than just one drug in particular? Because I never thought weed was, but it's more of trauma that's a gateway rather than the drug itself. Do you feel that way?
Yeah, so I'll say a couple things about that. One is that alcohol, weed, and also alcohol is actually equally bad and in some ways worse than weed, and also a common starter drug. But whatever the drug, all the drugs that people use, all the illicit drugs, most people use them in moderation. It's only a small subgroup that develops a problem. And in that subgroup that develops a problem, there are two reasons that apply to most people. Either they have a trauma history and or they have a mental health condition that they're sort of trying to self-medicate. Those two categories comprise the majority of people that develop a serious substance use disorder.
Okay, yeah, well, that does make sense because trauma can affect so many different things. So, like you said, it was alcohol, then weed, and that, but it was mainly the trauma. That was the whole trigger. It wasn't the drug itself. It was just trauma the most.
It was right. I mean, there is some evidence that some people have a biological, runs in families. You might have a higher risk, but even in that group of higher risk, still most of those people won't develop a problem. It's really, it's often about trying to cover up pain, whatever the pain might be. Or people have depression or anxiety and they don't understand that, and they use a drug and it makes them feel better, and so they start thinking, oh, this helps me relax, or this helps me be more social, or whatever it is. And so those kind of factors play a big role.
And for back then, when you were younger, 17, I'm guessing any mental health was a big stigma to where you couldn't just, if people found out you had a mental illness of any kind, it was a much more big stigma than it is today. Today, it's not accepted, but it's understood compared to years ago.
I definitely understood. I mean, I never heard of anybody going into therapy. It was just, I grew up in small town New Jersey in the 70s, and it was very in a very blue collar area, and so I never heard of anyone going to therapy. When I was 18, I actually did for a short time go to a psychiatrist about my drug use because I had been arrested, and it was to try to, make the court happy. And that was, and I was the first person I ever knew. He wasn't good. He didn't really help me, but I was the only person I knew who had ever seen anyone for psychological counseling. And that was really more just to try to get the court off my back. So it wasn't common. I didn't know anybody who had done it. It is more common today. And you're right. I mean, there's still stigma around mental health today, but substance use disorder, which is the modern name for addiction, that's also a mental health condition. It's in the DSM, which is the manual that psychiatrists and therapists use to diagnose you. Substance use disorder is in there. Substance use disorder is a mental health condition. It's a brain disorder.
Now, is it because when it comes, is it a disorder because of the way your brain and body react to the drug you're taking? Is that when it becomes is addiction may when it comes to that, is that the way it affects your body? Some people become addicted to things and some people don't. Is that basically what it is? It's just the way your body responds, basically.
So there's a couple things. One is that the earlier you start using substances, the more likely you are to develop an addiction. So one of the sort of pushes today when, say, parents talk to teenagers, it's not just about just saying no, which isn't really an effective message. But part of the message can be wait. If you wait to say drink until you're 21 or even 18 compared to 14 or 15, your odds of developing a problem are lower. Because part of it is that when you're young, your brain is still developing. And so the drugs have an even bigger impact on you when your brain is still in that early developmental stage. So that's part of the answer.
Yeah, so it's just like any psychological trauma. Your brain is still growing. It's still
Yes.
so it's basically kind of the same thing. Just you know, I'm trying to think of the word. It's the same concept, but just different things are being used. You're affected psychologically, and drugs are affecting you psychologically, but also physically. But it's the
Yeah.
same
Well,
concept. You got to let yourself grow and all that.
yeah, I mean, your brain, it is, part of your body. And it's just like trauma also increases your odds of developing anxiety. It increases your odds of developing depression and other mental health conditions. It's sort of rewiring your brain is the sort of the layman's terminology that's used. It's impacting how your brain develops, and therefore it can impact your mental health condition, not just with addiction, but also with other mental illnesses.
Oh, yeah, it can affect you pretty bad. Now, when when you decided to go back to go back to school, what was the situation where, because I think there are situations where people realize, you know what, I have to do something, or whether it's just gets rock bottom so badly, they're like, you know what, there's only one way but up. Sometimes that's how some people feel. For you, what was it that you were like, you know what, I got to do something, whether it was something good that happened, or something where you were told you have to do something? Like, what was it?
So for me, by the time I was 32, I had been using drugs since I was 12. I had been using meth a large part of the years from when I was 17, including shooting it for a lot of that time. And by 32, it was sort of multiple factors. I couldn't hold a job because I was using meth all the time. I was having physical problems because it's a very toxic drug. I was really just emotionally devastated. I was feeling helpless, trapped in a box, and my partner was ready to throw me out. So it was sort of like everything in combination that made me say, well, maybe I ought to go to rehab. And so that was how the process started for me.
Okay. What are the things? What are the things that people think when it comes to this type of stuff in recovery that they're wrong about, or you feel that they seem to be wrong about compared to the reality of what rehab and all that really is?
I think a couple things. One is that a lot of times people think that perfect abstinence from day one is like the norm, and it's not. I mean, there are some minority of people that manage to stay abstinent from the first day that they go into rehab or the first day they decide to quit, but most people can't. And I myself did not have perfect abstinence. I just had 30 years of continuous sobriety in January, but I used 3 times in my first 5 months. And there's a couple reasons for that. One is that, our brain is telling us you need it, right? You need it. But it's also because we don't know how to deal with our pain or our life. And so that's sort of an impetus. And then it's just sort of a habit. It's the way you think. And so for me, using 3 times in 5 months, that wasn't perfect, but that was sure a heck of a lot better, right, than I was doing. So
Yeah.
it was so that I think I know when friends and family see that their loved one who has started into a recovery path, when they see that they have a slip or a relapse, it creates fear, and I understand the fear. But it's important to know that that is part of most people's process. Most people who get to recovery, long-term recovery, start out imperfectly. And the other thing I'll say is that people think, you hear these data points like only 5% of people succeed or 10% succeed, but that's not true in lifetime. That's really focused on sort of each effort. In their lifetime, 75% of the people who have a substance use disorder will eventually recover. And so I think that's an important data point that a lot of people don't understand. The other positive data point is that once people get 5 years of continuous sobriety, their odds of ever picking up drugs, and when I say drugs, I always mean including alcohol. Okay, alcohol is a drug.
No,
But
yeah, yeah.
once you hit 5 years, you have an 85% chance of staying sober for the rest of your life.
When someone gets sober like that and everything, and it's been like 5 years, if they try anything again, do they do does it feel different to them? Does it make them more like sick? What I mean by that, like if the smell of something makes them feel sick or something like that. Because I've heard I know cigarettes are not the same thing. It's a nicotine. It's addictive, but it's not the same thing as what you're talking about. But my mother quit cigarettes years ago, and she said after a while, a few years, cigarette smoke or just smelling a cigarette made her feel sick. Does that happen? I know it's a completely different situation, but I thought about it because nicotine is like an addiction because there are people that smoke 3 or 4 packs a day sometimes. So does that happen also when you smell or or see someone drinking? Do you feel sick? Do you get what I'm trying to say?
I think it can vary. And let's say that somebody put a pile of meth in front of me and I actually smelled it. There is a certain chemical, smell to meth. A part of me physiologically, I think it would excite me. I think my heart would start racing a little bit. It would be attractive. It's not that I think I would do it. I'm confident I could say no, but my sort of unconscious visceral body reaction would be like, ooh, ooh. But it depends. I mean, I too don't like the smell of cigarettes after I quit, and I don't like the taste of alcohol. Like I don't order desserts with alcohol, but sometimes you're at a buffet or whatever at a party and you pick one up and it's got alcohol in it, and I don't like it. But it really varies from person to person. But the good news is that by the time you're at 5 years, you're usually very comfortable with just turning it down. I mean, I don't mean to underplay it. 15% of people will have a relapse after 5 years. That's not zero. That's about what, 1 in 7. But at the same time, for most of us, the hard part about turning things down or being triggered is in the early, let's say, 18 months to 2 years. That's the part where most people need to really focus, hyper focus on building a robust recovery platform for themselves.
Okay, so 5 years you have a higher of success rate, but you're saying within the first 18 months to for people to be ready that it could go the other way more easier. Is that what you're getting at?
Yeah, I mean, it's that's right. I mean, but it's not like a light switch, right? I mean, every month is usually better, but it also depends on what's going on in your life. You're just more vulnerable to what's called a recurrence today during in the early period because you don't have all the skills that you need or that you could use to first of all say no when you're triggered, but also to deal with your emotions. Sometimes it's that hard events happen. Maybe you have 15 months sober and a parent dies. Well, you'd be more likely to relapse at 15 months if your parent died than at 5 years if your parent died. You see what I mean? Because you just don't, you have
Okay, yeah.
more experience and more skill and more practice being sober the more time that you have underneath your belt.
Okay. Now, there are people out there. I think you touched on it just now, or we talked about it before this. That I was talking to you about how some people think it's self-inflicted, depending on the situation. If they're out partying, they feel it's more self-inflicted. There are people that think that, if there's trauma, and somebody like you had, you could be more enticed to do it because what I've seen is that people seem not to even bother thinking when they're on it. They don't think about their trauma. I guess that's what I've heard and been told. So and then there's what pharma, with Purdue Pharma, when they lie to everybody, that's not their fault. That's the pharmaceutical fault. So now they have an addiction. So there are many different ways people think about it. Now, do you think it's important for someone who's an addict to understand that if somebody has a certain opinion of it, the more important thing is that they're helping you rather than what their opinion might be? Do you get what I'm?
Yeah, so I'll say a couple things of that. One is that even with the opioid, pharmaceutical companies, putting America awash in opioids, people that developed a problem still had a higher risk of developing that problem if they had trauma or if they had other mental health. For example, some of the worst hit communities were communities that were economically devastated from plants closing, mills closing down, that kind of thing. That's a very high stress environment, and those people had a higher chance of developing a opiate use disorder. On the other hand, some people do develop an addiction simply from using, prescribed medication. We do distinguish between dependence and addiction. So let's say you have a back problem and you're prescribed opiates. If you're using the opiates sort of at a reasonable prescribed level, and it's not having negative consequences in your life, but you can't just stop because you go through withdrawal because you've taken them. That's considered dependence. You have a physical dependence, so you have to work with your doctor to taper off. Whereas an addiction is really about that there are negative consequences in your life and you keep on using. That's sort of the short definition of addiction. So they're really two different things. But the other thing is, you're right. I will say this, thinking that people just party and it's their fault that they develop a substance use disorder. A lot of times the people who think that have actually used drugs, including alcohol themselves, right? And so it's not that only people who were perfect and never picked up a drug, never had a drink, have that opinion. It's often people that did actually party at one point, but they got it, but it didn't develop into a problem. Or they have had, alcohol or too much to drink, but they didn't develop a problem. So part of it is thinking about being careful when we think about the partying side, to remember that often we ourselves partied. Okay, so that's my
Yeah.
point there. But
Yeah.
I do think that friends and family sometimes do think that they have a personal opinion that their loved one, that it's partly their fault that they developed the problem. But that doesn't mean they want their loved one to die. That doesn't mean they want their loved one to suffer. They still may want to help them get out of it, even if they think they're partly responsible.
Yeah. Yeah. No, because even if somebody has any opinions like that, they want to help people. So people put their opinions aside and help people with drug addiction or you said also dependency and all that. So Thank you for distinguishing between dependency and addiction, because people, I don't think, understand that. Like you said, they don't see that there's actually a difference between substance abuse and addiction. And something that you told me before was how Narcan is very, very, very important.
Yeah. So, I mean, you referenced how many of your friends have died, right? So, in America, we have, I think everyone's aware we have an overdose epidemic. In 2021 and 2022, for the first time, over 100,000 people died from an overdose in the US. I think 2022 was 110,000. That was an all time high. 2023 was slightly lower. I believe it's 107,000, but it's still very high. And 80% of those overdoses are opioid overdoses. So we've had an epidemic, and it's because the drug supply, the opiate drug supply, is now highly it's usually fentanyl. In other words, there's not much pure heroin left in America. It's mostly fentanyl. But also, when your teenager is getting what they think is oxy from someone, or Percocet from someone, a lot of times that's fentanyl too. And so it used to be that almost everyone who died of an overdose was a person with a long-term addiction. That's still the majority, but around 25 to 30% of the deaths today are more casual users. So it's, say, your teenager who it's the fifth time they used, or they use once a month, but they got something with fentanyl and they didn't know it. And so that's one of the reasons that Narcan is important. Narcan is a spray that people can get. Communities give it out. You can get it. It's over the counter now. You don't need a prescription for it anymore. You can get it at your pharmacy. Narcan, basically, if someone's having an overdose, you spray it up their nose, and it sort of kicks the opioid off of the opioid receptor, and they revive. The other good thing about Narcan is if they really aren't having an overdose, if you were wrong, it won't hurt them. So it's safe to give it to them. So
Okay.
that, which is really important. But I really highly recommend that anyone with teenagers or 20 somethings in their home have Narcan in their house, because the way these young kids are dying is they're dying behind closed doors in their bedroom. That's a high percentage of it. And it's important to have an honest conversation with teens about risks and to let them know that the Narcan's in the house. But it's also that it might not be your child. It might be her friend who comes over. I mean, it's just a good tool to have available. In the town next door to me, there was a 17-year-old boy that was overdosing in a park, and a woman had Narcan in her car, and she saved his life. So
That's
it's a
good.
really
Yeah.
important tool.
Do you think it should be in schools as well for any reason, or just kept out or kept in schools and as well? Is that helpful, or it shouldn't be in school, or do you think it should be? So
In
I
California,
go ahead. Sorry.
in California, it's mandatory that it's in schools now. And in a lot of other jurisdictions, they're putting it in schools as part of the first aid kit, because they're being realistic about, the risk. And so, yeah, I do think anywhere in California, it's generally in all the community centers and, the libraries, anywhere that there's a sort of public access, they usually will have Narcan around, because it's a lifesaver and because it's so easy for people to use.
Um, I was going to say something. Now I can't remember my thought. Hold on. Now you said that you're also, you used, sorry, hold on. Yeah, you're on the board of Life Ring, Secular Recovery, and also She Recovers Foundation.
Yes.
What made you get involved in that?
Everyone's familiar with the support groups for for addiction. Everyone's familiar with 12 steps, which is Alcoholics Anonymous, Narcotics Anonymous, and all the anonymouses. I mean, you see it on television. People sit in a room and they talk. Well, they're 12 steps is a good fit for a lot of people, but it's not a good fit for everyone. And there are other options. And Life Ring Secular Recovery is one of those other options for peer support. And I joined the board because their program involves an individual plan. It's called a personal recovery plan. LifeRing believes that each person walks into recovery. They're unique individuals. They're in a different place. They have different sort of philosophies, different problem solving styles, different priorities. So my recovery plan and Bob's plan sitting next to me are going to be different. And that's what I did. When I got sober, I didn't do I pulled a couple ideas from 12 steps, but not many. But I used other programs like Life Rings Parent, Women for Sobriety, and I pulled ideas and combined them into an individual plan that worked for me. And that's the Life Rings philosophy. So I joined the board because its program is exactly what I did. And then She Recovers Foundation, which I'm also on the board for. She Recovers isn't just for substance recovery, it's also for trauma recovery, mental health recovery, other behavioral disorders like gambling or internet or eating, also grief and overwork. It's sort of everything's together because most people trying to get sober have one or more of those other areas to work on as well. And in She Recovers, you can talk about it all together, like the interplay in your recovery. So, for example, in She Recovers, someone might say, I've been sober for 90 days, but now my food's getting out of control, or now I'm having trouble dealing with my emotions from the trauma. So you can talk about it as it plays out in a sort of interrelated way during your recovery.
That's good. That's good. I'm glad you were able to find something, and I'm glad that's there for women, to help them with their sobriety and everything. Speaking of internet, because I heard you mention internet, when it comes to the internet, do you think the internet kind of made it more enticing for drugs, or easier to get, or do you think it was going to get that way no matter what, whether there was the internet or not? Do you internet progressed it much faster if there was no internet?
Well, I will say this. Sometimes when we talk about policy decisions around drugs, there is a conversation as if it's hard for people to get drugs. Since I've been using drugs in the 70s, it's never been hard for people to get drugs. I mean, the internet isn't another way, it's a new way. And it has some additional risks because it's from strangers. At least when you were getting drugs from people in your community, you sort of had a relationship and word got out if, there was a problem. But at the same time, I know parents like to think that, we're doing things that are reducing the people's access to drugs, but we've never reduced people's access to drugs. There's always been easy access to drugs, at least in my, like I said, since the 70s when I started. So it's a new way to get drugs. Would they get drugs a different way if they wanted them? They can get drugs a different way if they want.
Yeah, exactly. Yeah, I agree. Yeah, no, I wanted to ask a question because since you started so young,
Mhm.
you've seen the differences of
Yes.
how people have gotten them, what made it worse, what fixed some stuff maybe. So you've been around long enough to see the difference. Did you see and notice an uptick when the internet came, or was it just about the same?
I don't think the data shows there was an increase in addiction. I will say that America, though, has one of the highest addiction rates in the world. So America, has almost a unique problem. But as far as the race going up because of the internet access, I haven't seen data that shows that.
Okay, okay. Now we talked before that about not on here, but you mentioned tough love versus something else, and you wanted to talk about that. Can you explain what that entails?
Yeah, because I know a lot of your viewers are not necessarily people with an addiction, but most people have friends or family that struggle with substances. And so a lot of people have heard of that tough love idea, cut them off. And, they see it on shows like Intervention. But that approach actually doesn't have very good response. So the current evidence-based approach is called CRAFT, Community Reinforcement and Family Training. And you can Google craft for families of, addicts, and you will find it. But craft is, first of all, twice as effective as tough love,
Okay.
but also it's focused on more positive reinforcement. So there's a book that I recommend for friends and family called Beyond Addiction. There's a book and a workbook. And Beyond Addiction is based on craft. But what the book does is it first of all explains what is addiction, what is substance use disorder, why is it so hard to stop, what's going on in the brain, what's going on in habit formation. But then it also gives friends and family techniques that they can use to help reinforce any positive statements or any positive steps the person takes that's struggling. But the book also makes clear what friends and family can't do or shouldn't do. So, for example, friends and family shouldn't demand a certain type of treatment or that you go into a certain program. It's important that the person with the substance use disorder has some autonomy and decision making ability. So, CRAMP goes into a lot of different topics that I think it helps people, families understand better, but it also gives them techniques that they can use that might have a positive reinforcement effect.
Now, because like you said, intervention, there's tough love. Is there, so you're saying crafts is much more effective, twice as effective, but is there any ever a situation where tough love is understandable or maybe needed, like, or both craft and like a tough love? Is that ever hand in hand with each other at all during any type of recovery?
Well, I mean, I will say it's not that tough love is zero effective, right? Every technique works for some people, but I think part of what you're getting at is it okay to set boundaries? And so, craft doesn't mean, for example, that you allow yourself to be financially abused or verbally abused, or somebody comes into your house and breaks things, right? Your craft includes setting boundaries and taking care of yourself. One of the things craft talks about is the importance of the family member taking care of herself during the process, because it is very stressful for the family. There's a lot of fear, and it's, can be a real roller coaster. But certainly, just because you're doing a positive reinforcement approach doesn't mean you don't get to set appropriate boundaries about how you're treated, or what your financial contribution may or may not be, those kind of things.
When it comes to recovery, what was your biggest fear concerning recovery for you when you decided to get? I know the reasons was, you said there were multiple reasons, including your husband, well, your husband now, which was he your husband back then or not at that point?
No, he was my long-term partner, but he wasn't foolish enough to marry me until I got sober.
Okay, all right, that makes sense. That makes sense. That makes sense. Yeah. So, well, the question. Go ahead. Sorry.
So you were asking about craft. Oh shoot, I forget the exact question too.
No, I asked when it comes to that. Um, I can't remember either. I just asked it. All right. So you were talking about craft. Don't worry, I can edit this. It'll look much
Yeah,
much
yeah,
better.
yeah,
Don't
yeah,
worry.
yeah.
Um, I was asking about craft, and I said something about your recovery. What was
Oh yes.
hard or something? Go ahead.
What was it that triggered? Why you said why? Why did you? What were the drugs serving for you? Why was I still using, and why did I go into recovery? And that's the why question is one of the things that's in Beyond Addiction. One of the things Beyond Addiction talks about is that there is a reason. What purpose is the drug serving? What need is the drug serving? And one of the things that Beyond Addiction talks about is that having an open conversation with the person who has the substance use disorder is helpful. Instead of acting as if it's all just negative, there is a reason for it. And for me, it was really that I felt that my pain, because I didn't just I had child abuse, physical and sexual abuse, but I also had several rapes when I was a young adult. I had a violent boyfriend, so multiple traumas. And I really felt that I had three choices. I could either commit suicide, or have a psychotic break and end up in an institution, or use drugs. Like, that's what I thought were my three options because of my pain. I was wrong, but that's what I believed. I believed I needed it in order to not kill myself or not have a mental breakdown if I was to survive. So the thinking was incorrect, but that was part of what kept me going for such a long time.
Did anybody know about that stuff, or they didn't find out until later on, much much later when you were older, when you told people about all that?
Well, I mean, when the rape, I had a kidnapping when I was 19, 3 men, 6 hour rape. And I told people at the time, but I didn't talk about it, constantly. On the other hand, sometimes women share, if someone share with me that something happened to them, I might share what happened to me. But it was always part of my worldview, and it was always part of my pain. And I didn't know how to handle it. I tried therapy a couple times when I was using, but the problem is that when you're on drugs, it's sort of like there's a barrier there, right? So I couldn't make any real healing progress in therapy because I couldn't really access my feelings. I couldn't really even understand my own history. And so the way I think about it is that if you have an addiction, it's and a mental health condition, because it turned out I was, when I got sober and I went into treatment, therapy, trauma therapy, I was diagnosed correctly with PTSD, which I didn't even know I had. And for me, it showed up as anxiety. But it's really hard to get to stay sober if your mental health is out of control, and it's hard to get your mental health under control if you're not sober when you have an addiction. And so it's really, today we recognize that you need to address both things from the beginning. It's called dual diagnosis or co-occurring disorder. If you have a substance use disorder and an additional mental health condition, you're going to have better odds of success if both are treated from the beginning.
Yeah. Sorry all that happened to you, and I wish it didn't. All that it's a horrible thing to go through. I've known women who have also been raped or anything like that, and so and you can see how it can change someone, or they react differently. Like if you see someone, then years later you see them again, they act a lot differently. It's a horrible thing to have happen, and it's unfortunate. It's 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 not good at all. It's not normal, but it's common, unfortunately. It's not a
Yes.
normal act, but it's very common, and that's you wish it wasn't, but unfortunately, a lot of women have gone through all that stuff. So
And that is why I use the subtitle of my memoir as One Woman's Triumph Over Trauma and Addiction, because part of it is I really wanted to show that you can recover from both, even if, even if you had, I mean, I had pretty extreme violence history and a very long-term drug addiction, and yet I got sober and I built a happy life. Not until I was 32. I also didn't get sober young, right? I mean, I was
yeah, yeah,
32. And so part of it is I try to reassure others in that situation that there's a path out, but also to reassure the friends and family that even if their loved one is still stuck in her 20s, it doesn't mean she's not going to find a way out later.
yeah. See, that's why I wanted to talk to you, because I think it's very important for people to see that whether they're a drug addict now, or they've been, or they've had any sexual assaults or anything like that, molestation, or anybody really, whether men,
Hmm.
women, because it does happen to men too.
It does.
Molestation happens to men and boys and girls, and rape has happened to men and women. So you hear that more often nowadays than you did years ago. But that's why I wanted to talk to you, because it's important to show people that you can get past it and still move forward, and still have a life. Unfortunately, those things happen, and it's not good at all, and it'll affect you forever. It does. I mean, things like that I think they would affect anyone forever, wouldn't they? Right?
I mean, the way I see it is that I feel like at this point I'm 92 to 95% recovered. It depends on the day. So, and do I ever think I'll be 100% recovered? Not really. I mean, it changed me in certain ways. But on the other hand, I'm perfectly happy. I have a good life and a productive life. And I'll say another thing to that. So I use my judge title. I use it I use it because society sort of has a positive social resonance to have been a judge, right? But it's not like that's the most important part of my recovery. That was my job. The joy of recovery in sobriety, but also of mental health recovery, is that I have, my life is not chaotic. I'm not making hard situations worse, right? I mean, hard situations happen to us all, but I'm not, making chaos out of more chaos. I'm
Yeah.
not, I'm able to handle my life appropriately. I'm able to find build relationships that are healthier, more rewarding, and with a stronger bond to my husband, and be of use to my family, being emotional and other support to my family. And I'm able to be productive at work, which, for me, using my brain and having intellectual challenges makes me happy. I like that. I am able to be a reliable employee. I'm able to be a reliable friend. If you invite me to your birthday party and I'm saying I'm coming, I'm going to show up with a present and behave appropriately. Like I didn't do any of that when I was using, So the judge thing is just sort of a symbol for that recovery can be so much more than you imagine. But the most important part of my recovery starts with having emotional equilibrium.
That's good. I'm really glad you were able to overcome that and become what you become, because not only for yourself, but having your journey is going to help other people when they read your book or see this. They'll, see the interview and you talking about it, that again, like I said, that it's not over. You can still make it, you can still move forward. And for some people, depending on circumstance, it may be a little harder, or extremely harder, not just a little bit, but extremely harder, depending on support system and the type of people that are around them. But it's still possible and it's not over. So hopefully people that watch this will get that indication from you and from this interview that, you still have a chance, whether it's psychological trauma that you're dealing with, or assault or drug use, that you could still move forward. It's very difficult, as you have said, and in general, but it can still happen. I think it's very important for people to know.
Yeah, and the other thing I'll say to that is getting my substance use under control. That was actually easier than getting my mental health, than getting my PTSD and anxiety. It took me longer to get my PTSD and anxiety under really good control than it did to sort of sever my connection to my addiction. And that's typical because the trauma was more complicated and it came first. And so it was a longer process. But I don't want to scare people just because it took years longer. It's not a light switch. It's better and better
Yeah.
and better and better and better, right? You're getting, it's improving. It's usually better like this up, but overall the line goes up. But it did take more work. I was in therapy for about 9 years, either individual or group therapy. And I needed that to really heal and understand my own history and figure out how to handle life in a new way.
And for therapy, it's important to find the person that's right for you, because not every
Yes.
therapist is right for that client or patient. You have to find the one that's right for you and understands what you need or what you need help with, and that it's okay to go in with questions, right? Or even an idea. When somebody goes into therapy, it's okay to have ideas about how you want to help yourself. Or is that bad, or is that considered a good thing, right?
Oh, I think that's right. I mean, I think a couple things. One is I interviewed therapists. I mean, I wanted someone who had trauma expertise. So I was asking them, how many women have you, counseled that had sexual assault? How many years have you been practicing? What's sort of your approach? And so I think it's reasonable to interview therapists. And then also, when you start with them, to keep an eye, is this a good therapy approach for me? I will say I wouldn't necessarily cut it off too quick because the therapist I ended up with at the time when I first met her, I thought she's a little too hippy dippy for me. Yeah. But it turned out that she actually worked for me very well, and so that was useful. But if she wouldn't have, I did try someone else. I went to her like 5 times, and I thought it wasn't a good fit, and I moved on. So it's okay to walk in saying, "Here's where I think I need help." But also to be sort of listen if the
Yeah.
therapist might say, well, what I think is really going on here is this other thing. Because sometimes the way we understand it may not be 100% accurate. And that professional expertise is part of why we're paying them to bring a new eyes to the situation.
Yeah, in a way, they're working for you, so you want to interview and,
Yes.
and find out all this information, but at the same time, you have to be receptive to something the idea that they may have. Once you pick one and you want to use that one, also be receptive to ideas they have, and then you have ideas for yourself, because you know yourself and what you've done in your life the most. So you know what something really might not work, even if they're saying it will. You can really say, you know what, that really truly just won't work with that specific thing, not because you're trying to give them a problem or refusing. You just know yourself so well. And I think that people have to trust some of the stuff that they know about themselves as well, and be honest to the therapist that, you know what, I have done this, I have done that, I have thought about this, I have, to get the proper help. It's not about just getting help, it's about getting the proper help that you need, rather than just getting help. It has to be very proper for yourself to be successful and move forward in a better life.
That's right. And I mean, the data shows that if people are active participants in building the treatment plan, they do better. But that's also true for substance use disorder treatment. I mean, so for example, a lot of times when you go into rehab, my rehab tried to force me into 12 steps and said there was nothing else and no other way. But the reality is that what treatment works, what peer support philosophy works, what program works for people, it varies from person to person. So whether it's for your PTSD treatment or your anxiety treatment or your substance treatment, not one approach is not going to work for everyone. There are luckily a variety of approaches, and some will work for different people. And it's okay to take sort of ownership of the process and making sure that you get what you need.
Yeah, yeah, it is important. And it's, you know, it's hard, like you've said, and it's just,
Yes.
I know I keep saying that, but it is a hard thing when it comes to any type of trauma, anything really, you know, because, you know, you're stuck with the memories, unfortunately. People that have gone through trauma, whether it be what you were talking about or just physical in general, or, there's also shootings and stuff like that too nowadays. So, it just depends on how it affects them and how bad it is for them, I guess. I mean, I don't think I don't think trauma is really easy to deal with no matter really what it is. I think there's just levels of the I'm trying to think of the word. I just had the word in my head right before I there's different levels of how it affects people. Certain traumas may not affect somebody as much as somebody seeing a mall shooting or assault or anything like that. So I'm trying to figure. I had it in my head, and then all of a sudden it disappeared. Right as I was talking. That ever happened to you? You're in the process of
Yes,
saying
of
something, then all of a
course.
sudden it disappears. Like where to go?
Of course, of course. But I will say a couple of things to that. One is that you are right. I mean, first of all, there's the traumas that are like one-time events. Um, those are not that they can have a long-term impact, but the trauma that happens over and over and over again, where you're sort of living with it, that is even more likely to have that kind of an impact because it's an extended period of time. But the other thing is that if you have good emotional regulation skills, if you're emotionally healthy, a trauma is less likely to completely derail you. I don't mean that it might not have an impact, but you're more likely to be able to get back on track. And some people have better resilience skills than others. So if you have a prior lengthy trauma history and then another event happens, which is sort of where I was, the odds of that new event having a significant negative long-term impact are higher because I already walked in damage. If you walk in a healthier place, your odds are better that you can resolve it more quickly. It doesn't mean that it's not an important event in your life. It doesn't mean that you might not need help, but it's when you have that sort of ongoing or repetitive traumas that your odds of having more difficulty resolving it or having more difficulty not making negative choices because of it goes up.
What would you consider the worst thing that somebody could attempt if they're trying to help somebody with trauma or addiction? What's the worst thing they could possibly end up doing to where it can make it worse?
I will say that sometimes people are sure that they know the solution and they're trying to impose it, right? And so, for example, sometimes family members are really adamant that the person with the substance use disorder has to go inpatient for treatment. Well, the reality is that not everybody needs to go inpatient. Now, also, many people who could use benefit from inpatient treatment can't get it. Because if you don't have insurance and you don't have money in large parts of the country, you're out of luck. You're not going to be able to go inpatient. But
Yeah.
sometimes family gets adamant, you have to do this, you have to do that. And that's taking away autonomy from the individual. And you may be wrong. It's better to have a conversation. Okay, well, when you're ready to go to treatment, let's talk about what your options are so that the person can choose among the choices. And it doesn't mean that the family members might not want to do some research. Like, let's say, find a good treatment program that maybe they're even willing to pay for, or here's an inpatient program, but here's an outpatient program. Which one do you think you would prefer? So it can be one of the most negative things you can do is try to impose your will on somebody's treatment plan.
Like if you don't do this by this time, is that kind of what you mean? Is that also what you mean doing stuff like that? Like what you were saying, but say, well, if you're not well by this day, or do you get what I'm trying to say? Because that I've seen that happen before with people. Like if you're not clean by this date, then you don't care or you don't want to even bother. I've heard people say that to different people. So
I mean, you are right. The setting the timeline for someone else isn't useful, and that sort of ties back to my lack of perfect abstinence, point of earlier, right? If the
okay,
family
yeah,
thinks you've got to go in and you better be perfect. You're not serious, or you're not trying because you're not perfect. That's a harmful message, and it's not true. Somebody could be really trying and yet not be at the point where they can be perfect.
I do appreciate you coming on here to talk about this stuff. Like I said, it's very, very important to people to understand that it's not over. Like I keep saying, that you can keep trying, and you know, there's hits and misses, unfortunately, with everything, especially this. But you could still keep doing it. So thank you for the advice that you've given people and talking about it. And your book is Junkie to Judge, a woman's. See, now I can't remember.
From
Oh,
junkie to judge, one woman's triumph over trauma and addiction. And actually, I will add this. So my book is available on Amazon and all the usual sites. My website is junkietojudge.com. And there are some of I've had opinion pieces in the Wall Street Journal and the LA Times and others, and those are there. Some TV interviews and other things are there. And also, you can message me through my website. So if anyone has any questions or any opportunities to speak, I answer all messages. I'm also on Twitter at Mary Beth O _, and I provide like the new studies that come out about substance use. I provide my recovery thoughts, and I'm on LinkedIn. So feel free to connect with me at any of those.
all right. Thank you very much, Mary Beth O'Connor, for coming on. Again, I appreciate it, and it's been a great conversation and great talking to you.
Thanks for having me. I really enjoyed it.
So did I. Thanks.